that should complete notes page 1. So let's go now, close your notes and go to the grid, Medicare grid, and let's start working our way through what we call the original Medicare A and B. So go to the grid, please. Now, Part A is called hospitalization insurance. You're going to notice on there that Part A has 0 premium. It's called premium free. Why is that? The reason Medicare doesn't charge for Part A is because you have been paying, and I have been paying into Medicare all of our life, as long as we've been working. So they're saying to us, you can have Part A at no cost to you. It's totally free. All right? Now, the way people get Part A premium for free is going to be based upon the quarters that they have paid into Medicare. Okay? Medicare taxes. So 40 quarters or more, your premium will be 0 for Part A. If you have 30 to 39 quarters, you can buy it for $252 a month. If you have less than 30 quarters, you can buy it for $458. Now, folks, listen, there are people that do this. They have to buy A because they don't have 40 quarters. So, folks, if it's free, it's a very good price, and it's a wonderful, wonderful insurance. Okay, now let me explain the quarters, because I know there will be people that are viewing or maybe in the audience today that don't have 40. So if we can't draw from a spouse, either present or previous, and you don't have your 40 quarters, and you're very close, we would encourage you, if you can, go back to work. And so a quarter is not a period of time. A quarter is actually a dollar amount. This year's dollar amount for a quarter is $1,410. So $1,410 of income, be it self-employment wages or W-2 income, will give me a quarter. All right? Now, I cannot get more than 4 quarters in a year, but I do not have to work the whole year to get 4 quarters. I just have to make, if I need 4, it'd be $1,410 times 4. And so if we have that amount of income, then that will give us our 4 quarters. Well, why? Well, because Medicare wisely knew that there would be seasonal workers and people who work part-time, and they wanted everyone to be able to get their 40 quarters, so they didn't tie it to a full year. They tied it to a dollar amount. And so that $1,410 will get you 1 quarter. So if we need 2, we're going to make $2,820. So however long it takes to make that, you'll have your quarters. All right? Okay, so we encourage people to go back to work if they can to move to that column. Now let's go through, and I want to talk about what is covered under Part A. Part A is, of course, called hospitalization insurance. Now you know how the premiums are calculated. And as you begin to use Part A hospitalization of original Medicare, you're going to notice that it is what we call an open access system, which means there's no network. So any hospital that you want to go to that takes Medicare money, which is probably all of them, you can go to that hospital. In other words, you don't have to worry about a network. Now, we'll talk about plans that have networks, but those are called Advantage plans. Advantage plans will always have a network. But if we stay in original Medicare, Medicare's our network. So as long as a hospital takes Medicare, you can go wherever you would like, all right? Now, what's covered under Part A? Anything that would be related to inpatient hospital care. You've been admitted to the hospital. This would be nursing services, your room and board, any tests or different things the hospital is running on you. A is going to pay a portion of the bills. A also covers skilled nursing facility. Now listen, skilled nursing facility is nothing more than inpatient rehab. So when a doc says you need rehab, doc can send you home, we call that home health care, send you to an outpatient clinic, maybe 3 days a week, or admit you to a facility. This is a skilled nursing facility. This would be very common after a stroke, maybe after hip replacement, maybe someone's taken a fall or had some kind of an injury and they need some fairly intensive rehab. So the A of Medicare will pay the skilled nursing facility. Also, home health care was covered under Part A. And in this scenario, this is someone who has gone to the hospital, they're doing well, they still need a little follow-up, but it really doesn't warrant a skilled nursing stay, so they send them home, and then a home health care agency will be paid through Medicare Part A. It's after an inpatient stay, so A continues to pay the bills. And then lastly, hospice. Anyone that's been diagnosed with a terminal illness or for whatever reason is on hospice, the hospice bills will be paid through Medicare A. Now financially, let me show you what it looks like this year, 2020. Here's the numbers. We have a deductible this year, $1,408, $1,408. Okay? That deductible is your out-of-pocket expense that you would pay, and then Medicare pays the rest. So you pay $1,408 to go to the hospital, and that's your full out-of-pocket for up to a 60-day stay. And what I want you to realize from this is this: whether you're in 1 day, 2 days, 10 days, 30 days, 60 days, doesn't matter. Anything between 1 to 60 days, you are responsible for this deductible, and Medicare pays the rest. And in case you don't know, that's a bargain. Average care right now in the hospital is about $5,000 a day, okay? Intensive care, critical care, $25,000, $30,000 every day. Medicare says you pay $1,408, and they'll take care of the rest all the way up to a 60-day stay. Now, this deductible, it is low, but it's also unique to Medicare. No one, unless you're on Medicare, has this deductible. This deductible is called a benefit period. benefit period deductible. Here's the way Medicare defines a benefit period. Our benefit period begins when we're admitted to the hospital. And let's say we go home 6 days later. That's about the average right now in the hospital. We're admitted, my benefit period begins, discharged 6 days later. So from this discharge date, for the whole next 60 days, if anything were to happen to me that would cause me to have to go back to the hospital, I am under the same deductible, I'm in the same benefit period. Got it? But let's say I'm admitted, I go home 6 days later, I'm discharged, and 60 days goes by and nothing happens to me that would cause me to be rehospitalized, but it happens after that. I go back to hospital, I start a new benefit period, and I pay another deductible. Let's suppose I get pneumonia in February. Real bad case of pneumonia. I'm in the hospital 7 days, finally heal up, go home. And then we get ice storm in November, December or something, and I break my leg and I have to go to the hospital and they have to operate on me, all right? There's certainly 60 days difference between February and November when I broke my leg. So how many deductibles did I pay in that year for Part A? How many? 2, absolutely. So it's not annual, it's tied to this benefit period, all right? So very unique to Medicare. Now, this $1,408 is my full out-of-pocket expense to the hospital for up to a 60-day stay. And you all know that's going to cover about 99% of every situation, most situations. However, there are times when people are in the hospital longer than 60 days. And so that third month, this would be day 61 to 90, notice now we're going to pay differently. Our deductible is no longer sufficient. Now they're going to charge us a daily copay. That daily copay right now is $352 every day. If I happen to be in the hospital longer than this third month, now I'm in month 4 and month 5, now I have a daily copay of $704. Now you do the math, we call these extended stays. That third month will cost you $10,500. Month 4 and month 5 will cost you $21,000. Now, frankly, most people that are in this period of time are not conscious. It's sad to say sometimes those people pass away, and your family is going to have to pay that. Medicare and the hospital is not going to write this off. If you've got it, you're going to pay this. And this is why I was saying to you earlier, it is pretty unwise to have A and B only, because if you ever had one of these extended hospital stays, it can be very costly. My own father-in-law was in the hospital during these days here, got MRSA through mishandling of dialysis equipment. Frankly, was doing pretty good, but on dialysis, had kidney issues, but they did some inappropriate mishandling. He gets MRSA and eventually goes into a coma, and he was in almost 150 days and then dies. Okay, so it happens. And when it happens, it's expensive. Now, people today who buy supplemental plans, what happens is all this can be covered by the supplemental plan, and if you're in the hospital more than 5 months, they'll actually give you a whole nother year in the hospital at no cost to you at all. Okay, that's what that supplemental plan will do. That's why we get other insurance for things like this. All right? Okay, so that's the hospital. Now let's talk about skilled nursing facility. It's also covered under Part A. Here's the rules. Medicare says the very first 20 days in that skilled nursing facility, they will cover all the expenses. Now, they attach one real important rule for them to cover all the expenses for the first 20 days. What's that rule before they'll pay? Anyone know? Come on, probably heard of this. You must be in the hospital a minimum of 72 hours prior to going to skilled nursing, okay? They require a 3-day stay. They call it 3 midnights, 3 full days, 72 hours or longer. You must be in the hospital before doc puts you into a skilled nursing facility. Folks, I've heard of stories of people getting discharged in 70 hours, 2 hours early, accidentally, and Medicare contested every one of those bills. We just had one of our agents the other day who wrote a gentleman who told her this story. It was about his mother-in-law. She went to the hospital, and they never admitted her. She was under observation for 5 days, okay? And then the hospital says, now it's time to send her to skilled nursing facility. What do you think Medicare said to that idea? No, they weren't going to pay. They had to admit that lady for 3 days before Medicare is going to pay the skilled nursing bills, all right? So they're dead serious about this 3-day stay because they believe a 3-day stay warrants then the cost of going to a skilled nursing facility. If it's less than that, they're just saying we're not going to pay for it. All right? So the first 20 days are on them. But after those 20 days, if you're still in, now they're going to charge a daily copay, $176. So this would be days 21 to days 100. They tell me the average stay right now for Medicare recipients is between 30 to 35 days. So they're covering their first 20, and then you would have a daily copay after that. That would be your responsibility. So that would be another gap that you would have to pay out of your pocket. Okay, so that is the A of Medicare. Now let's go to the B of Medicare. I look forward to having you join me in the next video so that you can continue learning the ins and outs of Medicare. When you're ready for personalized advice for your situation, All you have to do is go to MedicareSchool.com in order to get in touch with us. When you get there, you'll be given the opportunity to schedule a time to talk with an Enlighten You Medicare consultant. This is a completely free service for you and there's no strings attached. We'd love to answer your questions and if it makes sense, help you choose and get enrolled in the best plans for your needs.